enable. Forbes India presents the next wave of cloud innovation in association with Google Cloud.
The healthcare sector in India has seen a massive shift during the pandemic in terms of digital transformation efforts to improve quality and accessibility. Segments including telehealth, mobile health, electronic health records, and remote diagnostics and healthcare analytics have made great strides in improving user convenience and features, while on the government side, the National Digital Health Mission was established to provide the necessary support for integration of digital health infrastructure in the country. And we have still just scratched the surface in terms of possibilities that technology can enable to improve health outcomes and enhance the way enterprises operate in this area. Today, on this special presentation titled Forbes India presents the next wave of cloud innovation in association with Google Cloud, we'll get an inside look into how being digital first has enabled healthcare enterprises to address issues around intelligent patient monitoring, supply chain frictions, clinical inefficiency, and patient safety. I'm your host, Gautam Srinivasan, and joining me for this talk are Madhu Arvind, Chief Technology Officer at Apollo 24/7, Nikhil Khekade, Chief of Staff and Digital Transformation at Medica Bazaar, Anjani Kumar, Chief Information Officer at Strides Pharma Science, Ramasubramani Ganesan, Chief Technology Officer at Portia, Dr. Rana Mehta, Partner and Healthcare Leader in India for PwC, and Vamsi Ramakrishnan, Customer Engineer and Infrastructure Modernization Specialist at Google. Thank you everyone for joining us in this conversation. Let's understand the possibilities and challenges in the context of healthcare. Vamsi, we'll start with you. With COVID-19 disrupting the status quo in healthcare service delivery, telemedicine and remote patient monitoring are being increasingly adopted by service providers to virtually manage patients, predict and prevent illnesses, and improve clinical outcomes. What I want to know is, what are the application possibilities opening up on the use of technology in healthcare beyond telemedicine and teleconsultation that are being powered by the cloud?
Thank you for that question, Gautam. I'm pleased to be here this afternoon as a part of the esteemed panel. We at Google believe that in healthcare, especially in the area of remote healthcare delivery, whether it is outpatient teleconsult or remote chronic care or condition management, we are in the face of technology tillers. What do I mean by technology tiller? The first cars didn't have steering wheels, they had rudders, right? The first suitcases didn't probably have wheels. The most promising areas that are visible above the glass is in the area of patient experience, and more importantly, assistive and asynchronous tech to reduce physician toil, which is a topic that's a lot less discussed about. A simple example could be companion that transcribes patient interactions, reduces the pain of data entry through natural language processing, which also in fact is one of the biggest reasons of barriers for EMR adoption. A digital pen, for example, could capture the doctor's keystrokes while they write notes, or simple smart speaker that can understand medical dictation, or an accompanying smart display that displays patient history. So we believe that assistive and asynchronous technologies are the way to go, and we feel that we have a long way to go when it comes to improving the quality of telemedicine and teleconsultation.
Absolutely. And I'm waiting for the day where technology powers a use case where we can understand doctors' prescriptions. But let's hear from our industry leaders on how technology enables them to take healthcare services to the next level. Madhu, coming to you. Apollo's 24/7 app was launched just before the pandemic lockdown started, and it is among the fastest growing health apps in the country. And I believe it's operational in over 400 cities already. So tell us more about how the app is leveraging AI and ML and the cloud to serve users with personalized healthcare, including digital therapeutics and condition management.
Yeah, thanks, Gautam. So at the end of the day, before I say how we are trying to impact healthcare delivery using AI and ML, one should understand the state of adoption of any kind of technology in the healthcare sector. So today, if you actually go to a doctor, how a doctor kind of treats you or interacts with you is no different than what might have happened 5 years ago or 10 years ago or 20 years ago for that matter. So, typically what happens is you go, doctor's going to ask a few questions, and then, he's going to figure out what's the next adequate step for you. So this is unlike all the other sectors, like let's say retail or banking, where technology has really made a big impact in terms of how those services are actually rendered. So the real reason behind why this has happened is because the value addition that technology has brought in, let's say for a doctor or a patient or a consumer in general, is not to a level where this kind of drastic adoption has really happened. So the crux of what we are doing is, how do we actually create real value both for the physician or the doctor and for the consumer, so that we can really make a difference. So specific things that we do in that area are, for a doctor, as an example, for them to actually see any real value using technology, it has to really make a difference in how a doctor treats the patient, right? It has to really add value in that, right? So, and this, of course, is a problem statement that has been around for a long time, but really that process has not really happened. So, in order to do that, what we do is, in order to make such a solution work, two, three things have we brought together. One is, we use real world data from our, the essentially the treatment that our doctors have done over the last 10 years at Apollo. And that would involve, let's say, health records of more than 20 million consumers. Then, of course, the knowledge that our physicians have in terms of how treatment has to be done and so on and so forth. And we kind of put the two together to figure out a system where if somebody is actually coming in with certain symptom, right, it kind of helps them figure out, hey, what are the right questions to ask? What should be the logical next step? What is the prognosis? What kind of test should be done? We kind of build these tools using AI, which kind of assists a doctor answer some of these complex questions. And as I said, some of these things, honestly, expert systems have been around for at least 50 years. But how to execute it has drastically changed, and we are actually making a significant dent in that. One last thing on that also is, even from a consumer perspective, I think there is a huge opportunity in making a difference in this, right? We hear stories like India is the diabetic disease capital of the world, cardiac disease capital of the world, and so on and so forth. And my mother, as an example, who has been a diabetic for 40 years, still is not able to truly control her diabetes using various levers like diet, medication, lifestyle, so on and so forth. And the real reason behind that is, typically the system is, you see a doctor once a quarter, you do a test once a month. That is in the best case scenario. That's not sufficient for you to kind of fine tune all these different choices in terms of your simple things like diet or medication that you're really taking, right? So those are also areas where technology can kind of really, one, capture the appropriate information. Number two, figure out what kind of things can work for you and what kind of things don't work for you, and kind of enable things like condition management, digital therapeutics, and so on and so forth. So those are some of the areas that we are working on where we think we can make a significant impact.
Absolutely. And the wearables ecosystem has also evolved significantly enough that it's mature to be considered for the healthcare space. So that's a use case there itself. As you mentioned about, tracking diabetes, there can be continuous monitoring without the need for the patient to go to the hospital. But also, let's look at, in the context of value that you mentioned, considering Apollo is a major player with significant offline and online presence, with Apollo Hospitals, of course, being India's largest hospital chain. How will the app, the Apollo 24/7 app, synergize across the value chain to benefit users? What's the situation now, and what are you planning for?
Definitely, that's a good question. So, I mean, when I look at healthcare, it is inherently kind of omni-channel in nature. And what I mean by that is, there are scenarios where, let's say, you want to go to a physical clinic or a hospital, and there are scenarios in which you think, hey, maybe a video consultation with the physician is appropriate, or sometimes you prefer home collection for your diagnostics, or there are some tests which can only be done in a hospital or a clinic. So by definition, the requirements of an end consumer is met only by really putting all these different channels together. And so from an Apollo perspective, we deal with 70 plus hospitals, 1,000 odd diagnostic centers and clinics, 4,000 plus pharmacies. So the challenge of really bringing all these things together is a pretty complicated one. So where we started was that, to begin with, how do we kind of bring a single view of the user for all these systems, irrespective of what ERP systems they use and so on and so forth. As an example, if I go to an Apollo clinic, you should be able to see, what is really the health history of the consumer. And if I go to the pharmacy, they should be able to see, hey, when have you actually purchased these things before? When did the doctor kind of prescribe these medications? All of that information kind of has to be made available. So the first thing that we worked on was, even though different ERP systems are used by all these channel partners, we kind of bring that together and connect that and give a single view of the user. Number two is, beyond just the data, we kind of now have built various technology which will kind of help predict what are the impending or the immediate requirements that a user might have. It could be something as simple as, okay, refill of a medication that was prescribed or purchased, or based on your diabetic condition, the follow-up appointment that you need to have. It could be something, something as basic as that. But all of our different channels, right, whether it's a clinic or a hospital or a diagnostic center, will have access to that so they can act on it appropriately. And from an Apollo 24/7 perspective, the key thing that we also worked on was, beyond just bringing the data together, having one single interface for the user where he or she can avail of all these services, be it in a physical channel or in a virtual channel. As an example, a user can book an appointment to see a doctor in a hospital or a clinic, or a user can actually avail of that service virtually online, or book an appointment for radiology at a physical center, right? All of that stuff is brought together in one single app. And that's the kind of approach that we've been taking till now.
Absolutely. And it all boils down to user convenience, and technology enables that. But given the preview that Madhu has given, let's get in an expert perspective to respond. Dr. Rana, have we just scratched the surface here in terms of the role that technology plays in the continuum of care? Now that more hospitals are getting their digital act together, how do you see trends shaping up post-pandemic for the healthcare space?
I think you put it right. We just scratched the surface. I think, healthcare has been a very conservative area when it comes to technology. We've really not adopted technology. And if you look at hospitals in India, they're focused on acute episodic care. So, they don't know where you came from as long as they did the surgery. And when you go, they don't work across the continuum of care. What really happened in the pandemic, in a way, Gautam, was that they realized that they were not able to serve the patient because mobility stopped. So no one could come to your outpatient. When people didn't come to your outpatient, they didn't do your diagnostics. They didn't use your pharmacy. And, but they still had diagnostics done. They still had pharmacy at home. But it was not the hospitals which was providing them. So clearly the continuum of care was missing. And I think the whole focus now has come on to putting that continuum of care. So if we go back and, so 10 years later, if you ask me why in 2020, we had a transformation of digital healthcare, it was not because of the CEO, it wasn't because of the CFO, it wasn't even because of the CIO. It was because of the humble virus, right? Because we didn't change it because it wasn't broken. But I think now this has really catalyzed. Just like we say the vaccine, the vaccine would have taken 10 years. It happened in 10 months. So I'm saying that what would have taken 5 years happened in 5 months. And we're seeing that clear focus on the continuum of care. Clearly, the hospital providers are saying that we need to look at where does the patient come from? What is the data we need to get? There's a lot of data which gets generated but never used, right? For example, I have this, Apple Watch. It creates a lot of data every day, how much I walk. But in a way, it's a digital waste, right? Because when my physician sees me, and I'm a clinician, and when I go to a doctor, he never looks at that component. But I think this whole integration of data, which both gets generated in three places. One is it gets generated at your home. Secondly, it generates when you go to an outpatient. And then finally, when you get actually admitted. How do you integrate that data and use that to actually look at outcomes? In healthcare also, I think three things that come. Healthcare is about infrastructure, it's about process, and it's about outcomes. Unfortunately, in most developing countries, we focus on the first and the second, but we really don't look at outcomes. So I think outcomes and accountability is coming in because technology is enabling that. The other thing I think is, which you alluded to before, you have three accesses to healthcare. You have a geographical access, right? You have an Apollo hospital close to you, or Fortis. But 70% of Indian healthcare is just limited to 20 cities. So, very, very skewed. The second is you need to have a financial access. Can you really access? And, the PMJY program is a financial access. But if we going ahead in India, I think we have going to always have a limitations in terms of hospital beds, in terms of manpower. We never going to have probably the funds which is required. We spend only a minuscule part of our GDP. So I think the future is a technological access to care. A lot of what you doesn't require you to come to the hospital and can be done at home is going to be, I think, the way ahead.
All right, lots of important points brought together, and you're right. Finance also needs to be taken care of as a component of this, whereby financial access can also improve healthcare access for a lot of the people, and hopefully some of the government programs will help out on that. But when it comes to integration of data, that in fact brings to the fore one of the biggest challenges which presents itself when we talk about technology and healthcare, which is compartmentalization of data. And on that context, I'll bring in Vamsi. Vamsi, data of an individual's healthcare profile, it resides in many silos, including medical records, history of medication, previous lab testing and results, prior procedures, etc. And ideally, these are disjointed data sets, and these should interact to present a single and holistic view of the patient. But as Dr. Rana said, he has an Apple Watch, but his doctor is not looking at that data. But again, bringing all this data together is a challenge, since different slices of data, they reside in their own individual formats, they run in their own proprietary systems, or are structured in different ways. So how does the Google Cloud Healthcare Data Engine solve this issue?
Thanks again, Gautam. This is a topic that I'm extremely passionate about. I think every healthcare player is trying to solve their own version of the Tower of Babel problem. The biblical reference to which, when people of Mesopotamia tried to build a tower to reach heaven, God sort of confounds their speech and makes sure that people don't understand each other. I think the state of healthcare data is also in that sort of a situation. I think the healthcare data engine is focused to solve this problem exactly. First is, for example, your radiology department or your histopathology department stores data which is in a certain format. And hospitals use a format called HL7, which predates the internet typically, right? So the challenge is in bringing these silos of data into a single interoperable format, and this interoperable format speaks the language of APIs. This speaks the same interoperable format can speak the language of machine learning and speak the language of analytics. So providers or whoever has access to this data can focus on building higher order services that impact patient outcomes instead of plumbing with these silos of data. The second part is a very important point brought about by Dr. Rana, is that there is a lot of data that gets generated by a Fitbit or an Apple Watch. Now, the healthcare data engine provides a consent-driven mechanism to sort of upload this data to the healthcare provider if they have a universal healthcare ID. So, for example, if Apollo 24/7 has a patient ID, what we could do is typically plug in the healthcare data engine and help patients give consent, a time-bound consent, and upload this data. And this can be fed into the EHR, and this can be provided as insights to the doctor or the physician who's attending to this.
All right. Lots of possibilities opening up. But before I move on to our other industry leaders, Dr. Rana, how does the cloud framework in healthcare mitigate the triple burden of disease, which you outline in India, which includes accessibility of infrastructure, accessibility of finance, and accessibility of human resources? Now, the India stack revolutionized access to finance. Could the national health stack do the same for healthcare?
Yeah, like I said, I also believe that we'll have to build a technological access to care, right? Because that plays to our strength. I'll give you an example, Gautam. Way back in the 60s, the US also spent 5% of its GDP on healthcare. And that is when the government decided to move from a provider that's actually providing care, running hospitals, to becoming a payer. Very similar to what our government is doing today. So But the only advantage we have, and today we all know that the US spends 18% of its GDP on healthcare. But I think we have one big advantage. They didn't have technology. So, I don't foresee us spending 18% because, the public health spend is just a couple of percent as of now, and we may not have the financial resources. So I think it becomes very important to look at. And if you look at the National Digital Health Mission, I think it's putting those building blocks. Today, when even you travel abroad, and you really think something like the UPI doesn't exist in any other country, right? So we can be truly proud of the UPI. But can we really do that stack and say, this is healthcare records? Because I think it not only that, one is that, we obviously don't have the resources, but the resources are not also put to good use, right? Let me give you an example. If someone starts off from a village, he gets the test done in a village, then when he comes to the town, the tests are again repeated. And then he goes to a corporate hospital, the tests are again repeated. Because one, those test records are lost or they're not in a digital format. And so he's probably doing that CT scan 3 times. When, if he did it in an accredited place, that one record could be shown. So I think it will also reduce waste and, bring down cost. Because you said, accessibility to healthcare in India ultimately is limited by affordability. And that's what we need to work. How can we make it so? And I think some of the learnings from the financial sector, I think play in very well. How do you have immediate access? So, today, maybe I can't really go to a hospital, but 24/7, do have access to a doctor. Either I pay for it or the hospital or the government provides it for me. Very simple things, right? The 40 weeks of pregnancy, rather than having the ASHA worker going, which is good. But if that's not happening, can get lady even get an SMS every week and be told this is what you need to look out for. And if this is not happening, please go to your nearest health center.
Absolutely. As you mentioned earlier, the focus needs to be on outcomes. It's that context which provides meaning to all these measures that we can employ to improve healthcare in general. All right. Let's hear some stories of transformation from our other industry leaders in the healthcare space. Anjani, I'll bring you in at this point. AI has seen a boom in its capabilities for drug discovery, while cloud computing platforms have enhanced pharmaceutical workflows, especially when it comes to bringing agility to digital transformation. So how is it relevant from the perspective of, say, development, manufacturing, supply chain, and marketing pharma products for Strides?
Thank you, Gautam. Very nice question. I think Dr. Rana already talked about a point that what was being done in 8 to 10 years during the pandemic, you saw it is happening in few months, 5 to 8 months. And how was it possible? Possible has been due to digital transformation and the 3 things which was done: digitization, automation, insights, and AI. These are the 3 things which made it possible. So what you do is you looked at all the available medicines, available formulations, scanned it. Can it be reused, right? That itself helped a lot. Then you also look at what are the additional ones which used to take years. Now you are doing in days. The second part, once you are checking the efficacy of each of them, again, you use the power of data on the cloud, and months gets reduced to hours. The third one, even when you are developed, whether it is safe enough or not, whether it is on the patient when you go for clinical trial, not many people know about it. That in identifying the subject for clinical trial is a very tough area. How do you identify that this is the patient on which I want to do this? I want to do the testing. That's again, we use the power of the data. So these are the, in R&D itself. When you come to manufacturing, you have several systems, like you have SAP, you have a manufacturing execution system, ERP, manufacturing execution system, lab systems like laboratory information management, quality management system, and at least 12 to 15 of them. How do you, one, bring the efficiency so that you could manage the cost? India is very cost sensitive, and now the whole world we are seeing there is a hue and cry on medicine cost. The second is most important part from the pharma perspective. How do you bring the patient safety, compliance? And that is where we use cloud technology, we use automations, digitization, that there is no fiddling around in the process, making sure if people are doing something, he is putting contemporaneous data in the same time. So we digitize the logbooks. You have manufacturing execution system that it picks up the data directly from the machine using IIoT, and it puts in the batch record. So there is no possibility of, if it is not compliant, you see right away. And it does not, it checks the environmental parameters. If it is not in the limits, it stops the manufacturing right away. Until it is in limit, you can't proceed further. Then the third part, which we saw in pandemic, supply chain, correct. Remdesivir, not available. Several of the other ones, not available. Favipiravir, many countries had shortage. Supply chain has been vulnerable. It's just that it was not exposed before pandemic. And we saw now there is a concept of digital control tower, where you have demand planning, supply planning, and you get external data. Again, the data gets into the play. When you see in pharma, you would have heard that data is the new oil, but if you don't extract the oil, it has no, and do the refining, it has no use. So same thing. So in supply chain, data was always there. We never used to that extent, and now we are using it. On the sales side, it's a very different challenge. So sales side, people were used to going to the doctor. Reps were used to going to the doctor. All of a sudden, it becomes virtual, and it was not working. Many companies were not even prepared. So within a month, in some company, within a weeks, people were able to do it. In our company also, we used some of the virtual mediums, and the interaction became very different. And it became more important that you use the data, because doctor doesn't entertain the way they used to entertain in physical world. And it was a change management from doctor's perspective as well. But the good part is, now it is, previously many of the interaction will happen, everything was not logged. Now you have transcription mechanism, that when you are having a discussion with doctor, it is auto transcripted. So you exactly know what is the insight of the doctor discussion. And in the next discussion, you could put very focused points, what reps should be talking about. So this is where I think data and cloud is just changing the pharma industry. What was not done for years, we are seeing in last 2 to 3 years.
Absolutely. And it's fantastic to see the applications end to end, from development, manufacturing, supply chain, and marketing, these issues being addressed. And of course, technology helping you out on that, especially on the sales side. I'll come back to you to get your viewpoint on how data democratization works. But in the meanwhile, Nikhil, let me bring you in. Medica Bazaar is seen as India's largest B2B platform for medical supplies and claims to be not just a marketplace, but a health tech powered procurement platform. So how have your AI ML powered solutions, which includes VPO, Visi, MBGo, and MBR, enabled over 1 lakh of your customers, ranging from multi-specialty hospitals to daycare centers, to overcome challenges around costs, inventory management, supply chain, and maintenance and financing, and serve users in tier 2, 3, 4 cities?
Right. Thanks. Thanks for the question. Very interesting question. And so see, Medica Bazaar, if you see the kind of customers that we deal with, for large customer segments like multi-specialty hospitals or corporate chain of hospitals, the problems would be different. And when it comes to tier 2, tier 3 towns, maybe smaller setups, the problems would be different as well, right? So one solution essentially is able to create a tech-driven supply chain, and that is something which we feel that is going to create a big impact. And also at the same time, if we are able to help our customers to build some kind of a demand predictability from their end. So we have a product called as Visi, right? Visi basically directly integrates with the hospital HIS system, or even if you have past consumption data, you can simply upload, and it will tell you exactly what you need at what time and in how much quantity, right? So that is something which helps them build a predictability. Or on the supply chain side, of course, building large set of warehouses is only not enough, right? So you have to use AIML internally to make sure that you are procuring items at right places at right time. because accessibility is an issue, especially in tier 2, tier 3, tier 4 town. It's not that the data is not available, it's the lack of interconnected data, right? So even if you get the data, you need to work on your AI/ML techniques to make sure that you are able to predict that how much you need at what location, and especially in a country like India where the remote access has been, especially in the COVID, this was highlighted pretty at a very large scale, that people were not able to find products. Maybe those products were available at certain location. So as an aggregator or as a health tech platform, supply chain, which is a tech driven, will be able to solve a lot of these problems, and also working closely with our customers to bring them on a digital platforms. For large corporate chain of hospitals, their objective is for cost saving and operational efficiency, right? Now, how you do that is you use solutions like VTO and VZ and make sure that you build in that demand predictability and help them save cost, and they don't have to work with thousands of vendors over a period of time, and they can work with Medica Bazaar to procure and essentially make sure that they save costs over a period of time. For smaller setups, not just that they are able to get access to a large set of catalogs, which might be available in tier 1 towns, but now they can access to innovative products also through our platform. But also the predictability, the TAT, right? Something which you can say that, okay, you will get it this within a day or two or something like that, which really helps them and which actually gives them a lot of confidence to serve their patients as well. And on the financing side, of course, we have understood this problem, and especially with an emergence of a lot of solutions on book now and pay later, especially for the smaller setups like dentists, clinics, nursing homes, they can avail these options through our platform, and even though and they can manage their cash flow also.
All right, I'm interested in getting your views and Anjani's views on the sales productivity aspect of it and how digital transformation helps you improve that. But before that, let me come to Vamsi for his response to what you said, Nikhil.
Thank you. So I think one of the important points that Nikhil brought out was about the multimodal forms of interconnected data that they're wrangling with, right? In some of these cases, how we've felt is that a canonical data model, which goes above and beyond simply harmonizing data formats that are being exchanged between, say, things like their warehouse management systems to their operational tracking systems to their ERP or their manufacturing control systems. Over and above that, I think insights can be derived where let's say a canonical data model can go a long way in harmonizing locations, products, legal entities, assets, inventory, orders, and forecasts. That was the additional point that I thought would add value. Thank you.
All right. Thanks for that, Vamsi. All right. Let's bring the conversation back to the aspect of sales productivity. From a manufacturer's or a marketplace standpoint, the sales and marketing model has mostly thrived on face-to-face reach of customers or doctors or healthcare professionals in promoting the brands. Now, as lockdown started, so did restrictions to visit potential customers during the pandemic for sales and marketing teams. So, Nikhil, I'll start with you. And how did you leverage your digital transformation efforts to improve sales productivity? Your views first, then I'll come to Anjani.
Sure, thanks. So, see, one advantage which we already had that because we were always a retail first company, right? It's a young organization, a 6-year-old, where our approach and our vision was to digitize the entire ecosystem, right? So we already had a capability for anyone to come online and order products, even it's for a B2B user, right? So the platform education was happening for some time. The pandemic, suddenly people realized that there is no other option. We already had a large set of sales team which was there and we used to visit a lot of customers. They used to educate them about the platform and get the orders even offline, online both, right? But when the pandemic started, suddenly even the sales people realized that, okay, because I cannot meet, I can simply call up the customer and the customer already knows how to use a platform. They can order directly from there. Now this works really well for products which does not require clinical selling, but something like an equipment and all devices where you need to have a discussion with biomedical engineers and over a period of time. That's where we realize, okay, we need to bring in AR, VR in place. So if we are able to replicate at some level the experience of a sales experience of maybe showcasing a certain product using AR, VR, and that's what we try to do for few of our products, which were where team used to spend a lot of time with our customers, where we created a AR, VR model where they can interact on a mobile app or on the website with that particular device, getting more information. So it's not like a video, it's more like an interactive augmented reality setup where customers can interact with the product and find out more information about that product, and everything is built in. And now we are at a stage where we saw a lot of value there. Now, of course, after things started opening up, people are going back to clinical selling, but one aspect has definitely improved, that you don't have to start from scratch. You can always create that 3D AR VR model for people to take an informed decision, and then of course you can follow up with the physical meet as well.
It's great to see that, these are still not in conceptual stage, the AR and VR applications, but they are now being used more in real life applications. And we see that as one example of improving sales and marketing productivity. But coming to you, Anjani, in terms of democratizing data to enhance the productivity of sales and marketing teams, what can be done, or rather, what are you doing? And what are some of the best practices you could suggest?
So Gautam, the new buzzword is data never sleeps. 80% of our data, take any organization, has been created in the last 3 to 4 years, right? And we saw that. If you look at any organization, the data, accessing the data has been very ad hoc, especially the born analog companies like us. Of course, born native is very different. So native digital companies are very different. So what we looked at is the way we were doing, and another model in sales. Typically, people know that there is only a rep model, but when you go sell in US or UK or other countries as a generic pharma, there is another model called wholesaler model, or big retailer like Walmart or Kmart, Targets, and there are several of them. So you directly sell it to them, and you don't do any retail representation to the doctor, correct? So in that model is very, very different. What we do is we take external data like IMS data. You take suppliers data and you look at it. What is my availability out there? How much I have shipped and how much I can produce. Unless my sales folks have visibility to that, my retailers have visibility to that, they won't be able to predict what will be my next 3 to 6 months of data. And that is where I was talking about digital supply chain, digital control tower. It becomes more and more important. When we were working with data democratization, it's a very interesting model where we say anybody who is authorized to get access to the data, the form in which he or she wants, should be able to do. Easy to say, not easy to implement. If you implement this in traditional data warehouse model, it will take years, for any decent organization. But when you go to cloud, it could be GCP, it could be AWS, it could be Azure, there are Snowflake kind of thing. You are talking of within 8 months to 2 years, depending on how much data you have. You will be able to bring that layer, identify the sources, put that in the data lake, data warehouse setup, and then bring the access layer, API layers. How do you interchange the data? And here, as long as you are able to train the users, here you go. You make the user self-sufficient. And if you are able to do this, you are the organization of future and truly data-driven organization.
Absolutely. It's the age of DIY, whether it's for customers or whether it's for employees. And of course, technology enables that to happen. Fair point. Let's shift focus to the Portia growth story. Rama has been waiting patiently for us, but he's listened to all these insights. So Rama, the second wave of the pandemic saw severe shortages being reported when it came to hospital beds. Now, during this time, Portia offered oxygen support services, home ICU setups, and nursing services. And the first wave, Portia offered remote monitoring, home isolation, and teleconsultation services. Now, considering the 3x surge in demand during the second wave, how did technology help you overcome challenges associated with resource, logistics, and manpower to not only, say, enhance existing services, but also offer new ones, including, say, a technology-driven chatbot to disseminate authentic information about the pandemic? Take us through your entire technology curve.
Lovely. Thanks, Gautam. So I think when the pandemic hit us in the first phase, we were a little bit, all of us were wondering where this was going to go. And then at that time, if you recall, even the government of India hadn't really released any teleconsultation guidelines per se. And I think overnight, the whole thing underwent a complete change. All of a sudden, we realized that we had to call up, talk to close to 8,000, 9,000 folks per day to make sure that they are at home, comfortable, doing whatever was needed to prevent the spread across other folks. And if some of them needed medical escalations, we had to enable that without losing a single case where somebody said, I need medical help, and where we lost it. Now, in order to achieve all this, right, if you really take a step back and look at it, at one level, it's all about making sure the data that is being collected flows across all the folks in the ecosystem. You've got your backend ops, you got your clinicians, you got your customer support folks, and you've got the folks doing the calls, plus the customer at the center of it. All this data, if it is isolated within each department, it's going to be very difficult for people to look at each other's information and decide what has to be done. Link this to a lot of decisions which need to be taken based on the data. If you rely upon people to do the right thing 100% of the time, there will be some challenges at times. So how do you make sure that your system supports you in doing that as well? So I think that was a fairly interesting experience we had in getting all this set up in record quick time and making sure that you were able to service I think close to 3 lakh to 5 lakh patients, where we were able to connect with them, make sure that their concerns about the new disease were addressed. Plus, you were able to train and guide all the folks who were involved in operating the process, because even for them, the whole thing was new. So supporting them in that using technology, making sure that data was flowing correctly from the patient to the invoker, to the doctor, to the escalation team, to somewhere downstream. And then all data had to be parceled back and sent back to the governments for them to review as well. So we couldn't have done this in any way without any kind of I can't even think of how we would do it without technology in place. Moving forward to phase two, where I think not just the surge, we also realized that while people were a little bit more comfortable this time with the knowledge of the disease, there was a lot more demand for services all of a sudden, because you got people who need medical services. There were folks who were asking for oxygen concentrators, and the demand was very high, which means making sure things stayed utilized, making sure that the turnaround time between the request to the fulfillment, with all the uh, aspects in between, right, which rides in terms of the documentary requirements, making sure data was again flowing from the sales team to the backend fulfillment team very quickly, and then tracking, because a lot of these aspects, what happens is we're offering, for example, the oxygen concentrators for rental. So it's not just a question of delivering it. We needed to make sure that within the stipulated time, it was picked up and put back in the field for service to the next customer, so that you could maximize people who needed it. It's not, if you have a medical device lying somewhere in somebody's place unutilized, where somebody else needs it desperately, that's not a good place to be in. So we had to make sure that things are moving fast enough that we had complete utilization. And if someone says, I'm done, immediately get it back. Or if someone didn't say, we knew we had to go connect with them, get it back, move it to the next patient who needed that. Again, making sure technology was involved with all the right signals, processing all the data, super critical for us to do. You spoke about, I think, nursing care. I think over there, what also important is the small the isolation centers we created, because when you could have nursing was like severely under a shortage. So making sure that that nurse could potentially service more than one patient and being in a position to do so was very critical. Now, how would they do this? Very important to have connected devices which could monitor their SpO2, which could monitor their temperatures, which could gauge, is there something which could potentially go wrong, for the nurse to decide who to focus on. Triaging, very important over here, right? And that can't be done when you have all these connected systems running with data flowing to the right people. And all this, what we do, we also keep in mind that there's data privacy which is taken care of. People need to get access to data only if they need to. It can't be that you willy-nilly give it to anyone who says, I need the data. So managing that in addition to streamlining the data I think this was something that if you had
The
asked us,
balancing act.
balancing act, yeah.
But in
But
that balance, there's also retaining that human connect, right? As technology plays an ever important role in enabling more use cases, especially in nursing care, where, say, patients find themselves or found themselves relying on a digital first approach to healthcare, an arrangement that at first it might not involve a human on the other end of the exchange. And in fact, it could be automated. But in the healthcare space, I guess the human touch is still seen as important. So in your opinion, how do you bridge that human AI divide to personalize the experience for patients? And also, a single bad experience with, say, an automated customer service platform or an automated solution can quickly turn patients off to, the idea of enterprise AI solutions itself as a whole. So how do you prevent that?
it's an interesting question, Gautam. See, also being in the home healthcare space, we're offering services, right? And we've also realized that people are way more comfortable acquiring services when they speak to someone and they understand what does it mean, what are the trade-offs before they decide to go ahead with it. But at the same time, there's a lot of benefits when it comes to automation in terms of uh, bots being involved. So the right balance, like you mentioned, becomes very, very critical. And I think it's a question of figuring out how quickly do you push the boundaries. Because on one aspect, we have our customers who are very comfortable with technology. In fact, they expect that kind of an experience, right, from non-healthcare industries. But at the same time, when it comes to healthcare, they also have this perspective in mind that somebody needs to be involved. It can't be just a machine at the other end who's taking care of stuff. So I think two things, right? One is, what do you want to automate? Data collection, especially in terms of vitals, in terms of, I mean, we spoke about wearables. I think there are also a lot of Bluetooth devices now becoming a lot more prominent, which can help flow the data from the patient back towards the backend, where it can be monitored, thresholds set up, which can trigger interventions by the medical team as suitable. You overlay that with medical profiling done to figure out who needs what kind of help when, and then initiate that, and then hand it over to a particular uh, clinical team once the initial formalities are completed. That's how I would put it. I think we are a little bit some distance away from automating a lot of the stuff because patients need to get that comfort factor that they're speaking with someone who knows what they're talking about. It's a medical aspect over there, and there's a lot of touchy-feely thing going on. It's not just I click on a button and I get something going.
Do you think patients would be more comfortable, Rama, if it were about preventive healthcare rather than, say, prescriptive? Because for prevention, they might be more open, say, to using technology, using wearables and sharing the data, which in turn helps you solve the problem before it itself arises?
Well, again, it's a fair point. I would like to demarcate between data collection, data analysis, and intervention. So
I'm
while
talking about interaction, as in if you as a service provider told them that, use this wearable or use this technology so that, we can have a better interaction, they would be more open to using that. Whereas if they already are afflicted with a disease and you tell them or you give them automated options wherein they'll say, I need the human connect right now, rather than speaking to a machine. My question is to that.
Sorry to interrupt you, but I would add a small nuance to that. I think rather than prescriptive versus preventive, I would put it as chronic versus non-chronic.
Okay.
Somebody who has an acute problem needs immediate medical intervention. They are probably going to prefer someone to handle them through it. Someone who has a chronic issue, for example, we've got diabetes, hypertension, and other such issues where they need to live with it and manage it. I think the right mixture of technology and human intervention gets to the right costing as well. I mean, ideally, we would all love to have someone sitting with us, making sure we're eating the right things, monitoring our data very frequently, telling us what to do, what not to do. But it's also a little bit intrusive. Can someone intervene when needed, especially in a chronic? And even if you look at it, for example, when it comes to diabetes, right? CGM, that's something which is picking up pretty rapidly, where folks attach the constant monitoring device on their arms, and that keeps sending signals. which people can then track to figure out how is it going, is it helping me, hindering me, what am I doing? And doctors can use that to offer guidance in terms of where they need to focus on, what they did, and link up their diets to their sugar levels. Something like that, I think, will become a lot more prevalent over the next several years. The right mixture between using technology to monitor and intervene based on variations, not always.
All right. If you're offering that service, you could let Madhu know, as he mentioned earlier, that that space has still not evolved. And as he mentioned about family and having that issue. Madhu, I think it's time you give a call to Rama.
Yeah, absolutely. I think like what you said, the space is definitely evolving. There is a lot of use cases which can be which essentially can leverage these devices, which can translate the real events that is happening in a user's life into something tangible with the physician, or something someone essentially can take an action on, whether it's about is this diet working for you, can you eat 2 chapatis, can you eat 2 laddus, whatever it might be, right? So those are very tangible things which essentially are possible with today's technology. But I think in terms of costing of those devices and so on and so forth, we are in an early stage. But I think in the next couple of years, we'll see a significant change in adoption of these things, and also the impact that it can bring.
Absolutely. Anjani, I believe you have a point to add to this as well.
To Rama's point, what he talked about is a lot of the time digital is customers are not comfortable with digital. They would want to. It is also that I have seen, I mean, based on my customer experience of the several apps, the automation on the customer side, what is done is not intelligent automation. It is a very bot kind of. I mean, it gives me 5 options. If I want to add anything, it doesn't recognize. So that is one area where a lot of people, including Portia, could probably add. This second area is also, which I have seen enough number of time across the industry, digital and physical channels doesn't connect. So you booked a test, you got all confirmation, everything online, digital, through the app, through the bot. You get confirmation till 5:45, at 6 o'clock, you have the test schedule. XY person is on the way to pick you up. Person doesn't show up. 6:15, 6:30, you try to call up, the person says, oh, I am on leave, and I have already informed my supervisor, right? And then you know that their systems are not working together. So that is also important when people are moving into digital. And this example which I am talking of is one of the leading app I have myself experienced.
Indeed, interesting. Vamsi, your thoughts?
Friction between users and digital channels, I think I get reminded of what Dr. Ralph Speth, the CEO of JLR, Jaguar Land Rover, said. If you think good design is expensive, you should look at the cost of bad design. I think I think one challenge that I would say the healthcare players in the market face is that the moment when they transition to digital, they are subject to the same kind of expectations that they get of an e-commerce player that has developed and evolved over a period of time. So this transition, the smooth transition to remove user friction, and I think that's a point that even Anjani spoke about, right? Are these bots really intelligent is a very important question. I think in those areas specifically, I believe that cognitive services, specifically NLP, rather than modeling, say, for example, conversation like a flow chart, you have NLP, which is a lot more natural and contributes and gives a more human touch to the conversation. And if it's intelligent enough, it can hand it off to a live agent who's probably going to respond back. So this not only allows for economies of scale, but also allows you to still retain that human touch by pulling off the balancing act that I think Rama spoke about.
All right. As we head to the last leg of the conversation, let me bring in Dr. Rana. Dr. Rana, while we have discussed many aspects of, say, prescriptive healthcare, what role do you see digital technologies playing in the preventive healthcare space in the post-pandemic world?
Yeah, I think, we've always neglected the preventive side. But, one reflection on what was going, I also see the role of the doctor changing, right? The role of the doctor, I think, for the last 500 years has been the same. You go to him, he looks at you, gives you medicine, and you come back. And what we really think is, a doctor needs to have judgment, creativity, empathy, right? But when you look back and you look at it purely from a technology point of view, 80% of what he does is routine and process based. So he could be actually better deployed doing things which he need not do. And even when it comes to a differential diagnosis, and Lancet study said if you go to your primary care physician, his chances of getting your diagnosis right is just like flipping a coin. So that at some stage is a little distressing. So how do you bring in the trust? And what my other colleagues said is e-commerce, and they have actually evolved where trust is strong, right? You're buying the right product. If it doesn't work, you return it. While healthcare is different, I think I'm generally seeing that using the data, using algorithms, you could give another level of trust. See, I think one of the problems with all physicians, and this is a problem with us as humans, when I look at a patient, what is the knowledge I have? It's something I learned in medical school, something I learned by seeing patients, something which my peers taught me, or something which I learned from basically all the medical journals. But tomorrow, when I see a patient, and if he has symptoms, but AI tells me that in 200,000 people, if they had this patient, this was the differential diagnosis, that evidently takes it to a different level because my ability, I've become empowered. The second component of that is that I need not be there for every patient, and this is beginning to happen. I can have a differential diagnosis. I can just look at it, and it's like very much like an a CT scan is read by a machine and it says what it is, but I just validate that. Now, coming on the preventive side, and I think that's going to become very big because I think what is the definition of disease actually is changing, right? Today, we really associate illness when we are either have a problem or we'll end up in a hospital. But given the whole genetic component, you're pretty much able to predict, say, like a child who's even 2 years old, that he'd probably have diabetes at the age of say 30. So because there are two factors, there's the genetic factor which you can do very little about, and then there's a whole environmental factor which you can do everything about. So can you have a lifestyle coach? Can you have a physical lifestyle coach that you don't need, you've eaten enough French fries, you need to move on, or can you have a virtual lifestyle coach? So I think those components where uh, because preventive healthcare today and has not really worked because we've lacked a business model to do that, right? When you look at your phone and you look at the apps and you paid for many of these apps, how many of the healthcare apps have you paid for? Practically none. So I think that pressing case about putting what is the business model, why should I do it, is something I think we've all been struggling for. And I think that search for a business model will will make the other things. It's like you always had the cars around, but Uber put it together, saying that your most non-productive asset is the car lying in your garage, and you can use it better. So I think those components which are coming in, along with technology, will be a total game changer. So in 10 years, I think the way we access healthcare would be very different. You may even have a hospital, and there's a hospital in the US, which has doctors, it has nurses, and it's patients, and it has technicians, but it has no patients because the whole idea of that institution is to ring people and make sure they're healthy and they don't come to a hospital. So I think that paradigm shift, it's going to happen, but I think it'll take some time.
Absolutely. Well, new business model, new business opportunities, and new ways to approach healthcare. As you mentioned, virtual lifestyle coach. Some of these could be gamified as well and made more interesting to improve use cases. But it's almost out of time. So let's conclude the conversation on a strategy note. And for that, I'll come to Vamsi. Vamsi, in terms of infrastructure modernization, especially for large but legacy players in the healthcare ecosystem, what should be the key priorities for a scalable and secure transformation?
I think the fundamental problem we're trying to solve is how do we achieve a non-invasive transformation? How can all legacy healthcare ecosystem players transform as consumer internet companies and build a digital care front, like a digital storefront? And we feel that it is a problem of three things. One is how can you bring the data on premises onto the cloud in a secure way? And how do we make sure that during this process, there is no disruption to existing business, and how do we do it in a secure manner? And we call this secondary healthcare layer as a phygital bridge. This phygital bridge can be a combination of data, APIs, and applications that can act like a sort of a middleman that can intelligently understand the difference between a physical origination system and a digital origination system and fuse this data. We feel that building this secondary phygital layer backed by a very strong and scalable and planet scale infrastructure is what should be the priorities for healthcare players. Thank you so much.
All right. On that note, it's time to conclude our conversation around the role of technology and the cloud in improving the healthcare ecosystem in India as part of our special presentation titled Forbes India Presents the Next Wave of Cloud Innovation in association with Google Cloud. I'd like to thank all the panelists for joining us on this talk. And of course, thank you to our viewers for tuning in. This is Gautam Srinivasan signing off.
Forbes India presents the next wave of cloud innovation in association with Google Cloud. Focus, ideate, innovate, enable.